So thank you very much for inviting me here today. As I was introduced, my name's Matt Prime. I work for Roche, Roche Information Solutions, and by background I'm a doctor and I lead evidence generation globally for our digital products. So I think when you think of Roche, you think of a company that is primarily involved in the diagnostic and pharmaceutical industry. However, we have over a number of years been developing a lot of solutions, informatic solutions for both laboratories and providers of care. So today what I'm going to go over is our oncology portfolio. If I can make this work. There we go. Okay, so I think many of you in the room will be very familiar with some of the challenges that healthcare systems are facing. All over the world, we know that there are going to be huge staff shortages, not just clinicians, but also allied health professionals and nurses. We know that costs are increasing. We also know that we've been left with a huge legacy from COVID, right? You know, in my own health system, the NHS, we have massive backlogs of patients waiting for care. And we also know that despite all of that, information marches on. I think the gentleman who just spoke said, you know, there are 50,000 papers on COVID. Well, if you're an oncologist, to keep up to date, you would have to read for 29 hours a day. It's simply not possible. So for Roche, and particularly for Roche Information Solutions, we're really striving to create a connected and agile healthcare system where digital technologies are really enablers of better care. So our approach and how we focus that is we try to be very patient-centric. So we're not thinking about the technology first, we're thinking about what the clinician, the HCP, and the patient needs. We try to be driven by the science and the evidence. And we want to have an open ecosystem. So lots of people here today are talking about their solution, but this all has to come together. You know, I was reflecting on the sepsis example. I mean, I've managed lots of patients with sepsis. But yes, the model may be fantastic, but it needs to link to a doctor who needs to go and do something. So we need to think about how all of these things can work together. So I'm going to frame our discussion or the presentation around a patient journey. And so many of you will be familiar with this. At the start, there is screening, there's early detection. Then there is diagnostics. Then there is using all of that information to make a decision and come up with a treatment plan. And then we need to monitor patients when they're on treatment. And for cancer patients, we need to constantly monitor them in follow-up and survivorship programs. So as I look at our portfolio and I try and frame that for you, I'll start with the top, and I'm going to kind of give you case examples. One of our products is really an enabler, OncoHub. It enables lots of different use cases and product use cases that are real problems that clinicians face. Now, starting at the beginning with early detection and screening, we have two very interesting products, and I'm going to talk about AlgoSuite. So AlgoSuite is a product that integrates into the healthcare landscape, the informatic landscape. It pulls the data together, and it allows and enables different algorithms. All of the algorithms, the AI solutions that people in this room may be building. But this then delivers it via a lab information system into the clinical workflow so that a clinician can see the flagged patient who may be at risk of colorectal cancer, or the flagged patient who may be at risk of lung cancer. Moving into the diagnostic phase, we have two super interesting products. One is digital pathology, and that's not really a product in itself. I mean, that's a whole thing. I remember when I started clinical practice that my first job was running around a hospital trying to find hard film, so the actual images of broken bones. And almost overnight, that stopped with PAC systems, picture archiving communication systems. So I think that, you know, digital pathology can really do that for the pathology lab. Now, that platform then enables all of the image analytic tools that people may be developing, and it becomes this ecosystem. The second product in the diagnostic space is what we call navify mutation profiler. So this is a product that consumes the variant copy file from a next-generation sequencing readout and actually reviews that data and creates treatment options. Now, if we are to do that as individuals, as bioinformaticians, that can take days and days. This creates a result in 10 to 15 minutes. That's a significant time saving and cost saving for hospitals as they try to adopt these new technologies. Then we take all of that information, so whether it's a pathology slide, whether it's imaging, whether it's sequencing results, and we have to discuss it as a group of clinicians, a multidisciplinary team. And there we have a product called Tumor Board, which consumes that information, presents it in a very easy way, and enables clinical decision support. So again, it's really about enabling other clinical decision support tools and really enabling a much deeper decision. So from there, we're now working on solutions around patient engagement. So we've gone all the way from the early detection to the diagnostic phase, the treatment and decision phase, to patient engagement and monitoring patients when they're on treatment for symptoms, trackings, for outcomes, so that we can start to kind of really give a holistic experience, digital experience to patients. So I'll go over a few of the products in a bit more detail, talk about the specifics of them, and then I'll give you some examples of where we've done this. So navify Tumor Board. This was one of our first products, and this really coordinates a multidisciplinary team. So when you make a decision about a patient's treatment, you have the pathologist, the radiologist, the oncologist, the nurse specialist, all giving input onto this patient's case and what should be done. So again, when I think back to my clinical days, I would run around, try and log into the EMR system at 9 o'clock at night, try and pull the information together and put it all onto a PowerPoint presentation. Today, I would put the patient's details in and all of the information would just be there. And all I have to do is really think about the patient's care, not finding the information. Gosh, that went quickly. If I just go to the next slide. So just to give you, oh, I have to do it, hang on. So just to give you an example in the United States. So this is Ellis Fishel Cancer Center, and this is a study that involved 1,800 patients. And we really tried to look at the time that it took to prepare the cases and the time it took to present and what the outcome and the decision was. So we showed that over 1,800 patients, we speed up the preparation of time by 30%. We streamlined the case discussion, and that led to massive reduction in postponement of cases. And overall, just in one hospital with 10 tumor boards, that leads to a saving of around $300,000. So you can really see how digital solutions can have a really meaningful impact on a clinical environment. Let me just skip through the others quickly. So guidelines are very interesting. We all want to do guideline care. We really want to give the best care for patients. We have a partnership with the National Comprehensive Cancer Network in the US where we've digitalized their guidelines. So it will automatically place the patient into the relevant guideline section, massively speeding up review. Now, to put that in context, for non-small cell lung cancer, the guidelines are 175 pages long and they have 2,000 references. So if you were to do that for each patient yourself, that would take a huge amount of time. We also, through the Tumor Board, can match patients to relevant recruiting clinical trials, geographically based. And we have a huge number of analytics dashboards, so you can really see what's happening in your health system, how many patients you're treating. And that starts to get to this model of learning healthcare systems, where we can appreciate the data and we can really change how we deliver care and improve it. And finally, one of the key metrics that we all think about in cancer care is time to treatment. This allows us to track it and really make a meaningful impact on that. Thank you very much.
Ďakujem veľmi pekne. Thank you very much.